Hi there, and thank you for joining us for the Peer Assessment Information Webinar for 2023. My name is Dana Prucci. I'm the Director of Professional Practice and Quality Assurance.
And I'm Sarah Chapman-Jay. I'm Advisor for Speech Language Pathology Professional Practice and Quality Assurance. And I will also add that I have been peer assessed in the past, so I'm already aware of what you must all be feeling like. And I've also been a peer assessor. So I've got a few different hats here that hopefully between Dana and I, we can help you out with what to do when you are preparing for the peer assessment.
Absolutely. So as always, for best viewing, it's good to shut down other programs that you have running on your computer at the same time. If anything happens and you have technical difficulties watching the webinar, best to close it down and then reopen again, join again. Finally, this recording will be recorded, and we will have recordings published to the website on the peer assessment page. There's also a place that you can ask questions. We'll be breaking for questions a few times during the presentation today. There's a little orange box with an arrow, and if you click on it, you'll find a place you can enter questions, and we'll be monitoring questions and again answering them throughout. So here is our agenda for today. We'll start by talking about your preparation for the peer assessment. We'll talk about what happens at the actual peer assessment and then what happens afterwards. And all of this information and more is available. We have lots of resources on the website, and we can go to it now, but it's under peer assessment. So let's go through it together. If you hover over the word registrants at the top, partway down the middle is peer assessment. And so it will take you to this page. So you can see we have a clinical peer assessment guide, a non-clinical peer assessment guide. Sarah will be talking about the clinical reasoning tool, and so you can actually see what's going to happen there. And we also have a letter for employers about information, what happens at the peer assessment. So we wanted to start off by talking about, why does CASLPO make us do these peer assessments? I'm sure many of you are asking that question. So just a reminder, this is not a CASLPO decision, but it's legislated by the Regulated Health Professions Act. All 26 colleges do some form of peer assessments. Your chiropractor, your massage therapist, your dental hygienist, they all have to do something like peer assessments. Peer assessors, just like Sarah, have all been peer assessed themselves and know exactly what it's like to be in your shoes. They then went on to become peer assessors. Peer assessors go through annual training and take on a number of peer assessments every year. They are warm registrants who want to give back to the profession and like meeting people, and they love hearing about what you do in your roles. Peer assessors and this process are not out to get anyone. This process is not punitive. It can be a very positive learning experience. Registrants really enjoy talking about their role, their challenges, and successes. It's a conversation about your practice.
Excellent, Dana. All right, so we will take a look at the self-assessment tool, because this is what you need to be using to provide your evidence. So when we look at we're going to mainly focus on the clinical self-assessment tool, but obviously we know some of you here are doing the non-clinical. So the clinical, actually both have this: practice description, professional standards, and learning goals. So for practice description, I think most of it is self-explanatory. So, you know, where you work, how many years you've worked, the area of practice, do you work with support personnel or not? Have you been delegated any controlled acts? So you fill those in to best suit, obviously, your type of practice. What we want to look at specifically with you right now is in number 8, there is a box here that to provide additional details of your practice. Well, why would you want to do that? You know all of this, but the peer assessor knows nothing about you yet. I mean, we will be connecting you with people who work in the same area of practice, but this is an opportunity for you to share additional information. There could be some roles and responsibilities about your current practice that are not identified yet in these checkoff boxes. So fill them in on any additional details you think would be helpful for them to gain more insight into what your practice is all about. And finally, on this practice description section, there's number 9, and please complete this section, because this is how the peer assessor is going to reach out to you. They need to know your name, registration number. Actually, that can be helpful because all of our registration numbers and names are listed on our public register. So if they want to get a quick idea of your practice location, what age groups you work with, that will help them find that as well. A telephone number, the one that you use the most. How do people easily reach you? What number could you provide? An email address as well. I know that sometimes, certainly people who work part-time provide their work email addresses, and it may not be something you access frequently. So for this, really think about which email address you want to provide for the peer assessor. That's its main purpose, is how can they reach out to you? And finally, when would you prefer the peer assessment to take place? So peer assessments all start in April and go right through to the end of December of 2023. So some of you immediately want to do it April, May, June. Others prefer the summer if you're school board sometimes. There's a whole range, obviously. So you choose when your preference would be. So that is some ideas for practice description. We're now going to move to professional standards because this is where the bulk of your work will be. We are asking you to upload evidence. Now, for clinical professional standards, there are 30 different professional standard indicators. So we need a response and something that you provide as evidence in each of these indicators. So for example, in management practice, there are actually 10 indicators in this section, and 1.1 is the first one. Now, Dana has just shown us a very important icon to look at. There are examples of how to meet the standard for all of these indicators. So for this one, she clicked on that, and we've now got 5 bullets giving you some ideas of what kind of documentation you can provide as evidence. Now, so under the bullets, we've got I meet the standard, I need work to meet the standard, and not applicable. So you're going to check off which one applies to you. And then below that, there is in blue font, required for peer assessment, upload evidence from patient records. Now, 25 out of 30 of these indicators all require that you provide evidence from your patient record. Dana's now taking us to the guide. So she's already explained we have all these resources. Everything you might miss today on the webinar, go back to the guide. So in the guide at the very end, there is an appendix for both clinical and non-clinical. So this one is the clinical one, and it lists all the indicators, 1.1 to 1.10, all the way through to 5.2. And it tells you what kind of evidence you need to upload. So let's even see these first 5, all of those first 5 require that you provide evidence from a patient record. We are only looking for one piece of evidence per indicator. So one piece for 1.1, 1.2, etc. Of course, there are exceptions to every rule, and we have 2 exceptions, and they're actually on this first page. So 1.3, this is specifically for audiologists who perform and document the controlled act of prescribing a hearing aid. We actually, for this indicator, require 8 pieces of evidence, which sounds like a lot, but you'll understand when I explain. So take a patient record where you have prescribed a hearing aid. What the audiology peer assessors would like to see is the sequence, like the phases of how you intervene when you've prescribed a hearing aid. So you would start off with a hearing aid assessment, so a screenshot of your assessment. Then you would go to the hearing aid prescription. Then you would go to verification for the hearing aid and validation of the hearing aid. So that would be from one patient record. And then you would repeat exactly the same for a second patient, looking at the second patient record, doing hearing aid assessment, prescription, verification, and validation. The other indicator that requires 2 pieces of evidence, and this is to any of you who are accountable for support personnel. So this is 1.5, when you're accountable for support personnel providing intervention under your direction. So for this, you could do 1 piece of evidence, maybe in a patient record, where you co-sign your CDA's signature when they have done some clinical activities, assigned activities. The additional piece of evidence could be some other way that you show evidence that you've supervised the CDAs. So it might be patient consent for CDA activities. That could be one option. It could be what kind of CDA participation is involved in the service delivery. So the evidence, you're going to be thinking about it. You may have already done some. You may have more to do. We're looking for the evidence to be uploaded by March the 7th. Now, the other important thing when we were looking at the evidence, and Dana's going to show you how you enter all of that into the SAT, is, and we've talked about the drop-down examples. So the other type of evidence, and there might be, oh, we can see even on 1.6. Sorry, Dana, could we just pop back to that other one? I'm sorry. With 1.6, this is when maybe you haven't got to upload from a patient record. What you need to do is upload maybe some other evidence. So 1.6 is I ensure that all materials and equipment, including clinical tools, assessments, and therapy materials used in my practice are current, in proper working order, and calibrated. So in this case, what you might actually provide instead is a photograph or a live recording of equipment and materials. So with this appendix, take a look at it because it gives you examples of what you can upload with each of the indicators. So the other thing we want to say is, do you have to upload an entire record per indicator? No, you do not. You can upload a page and maybe highlight what is relevant on that page. So for example, we've got a pretend example of some clinical notes, and this is somebody who's a child. And so we can see the sequence of events. September 1st, there's a note, September 9th, and September 17th. So 4.3, which is about collaborating with others, is highlighted for this example. So September the 9th is when this clinician spoke with Sam's OT, and they're working on sensory integration. So this would be a very valid piece of evidence to demonstrate how you're meeting that indicator 4.3. Now, it could also be applicable for 1.2, which is I maintain my records in a reasonable time or a reasonable manner. So because it's showing September the 1st, September the 9th, September the 17th, and other parts of the record regulation are that you always put on your clinical note who the patient is, what the date of birth is, date and time that you've been in touch with them with professional contact. So there's one example. And I think at this point, Dana, we will pass it over to you.
Okay, great, thank you. And also to add, we wanted to do with this example, we don't want a little snippet. The peer assessor doesn't want to see like a little piece of a record. So if you have a whole page of intervention notes, put on the whole page and just show what it is that you want them to be looking at as opposed to just a tiny thing. Sarah was saying it's nice to see the whole order and how things progress. So let's talk about uploading. There's lots of information again in the guides. The most important thing, the first step once you've chosen what it is you want to have would be we recommend saving it on your desktop, and then you can upload it to the SAT. Rename it before saving it. We recommend using PR and then the number for the patient record and the standard. So for instance, I still have John S here for hearing aid validation. So I know that is for, he's actually PR1. So I'm going to make a note to myself. This is evidence for 1.3. And that way it's easier for me to know what it is that I'm uploading, and you can't change the name once it's already uploaded. I'm not going to go into detail about how to take pictures. If you have paper files, you can take pictures and upload it. You can email it to yourself. If you want it's on the computer, you can take screenshots. If you need any help with IT, then hopefully you have an IT person near you that is able to help. But we'll look exactly at how you do the uploading. And another important thing to remember, a very common question is, do we have to redact personal health information? So no, you do not. The Regulated Health Professions Act supersedes PHIPAA. However, if you want to, you can. Frequently, we hear from companies that have concerns about uploading personal health information. And if you or your employers have concerns, have them call us. I showed before that there's a letter that's available that you can give to your employer. The SAT website is very, very, very secure. So that's why it's fine to upload personal health information. We have a letter actually from the company with all sorts of IT jargon that I don't understand that we're happy to pass on to you to share with your privacy or employers. So again, let's go straight to the SAT here. So you have your evidence, you're ready to go. Another piece of advice we have from our peer assessors is if it's a picture, please be sure not to upload it upside down. Check your evidence before you upload it. So what you can do, let's see, I'm going to upload some evidence for 4.2. So I'll go to 4.2. As Sarah was saying, we're going to click on the little blue thing here. So a menu will pop up. You can choose file. So I'm going to find my handout for 4.2. Upload files. And so a really important thing to do is this comment box. Some of the peer assessors say the comment box is even more important than what you upload. So you want to explain what it is and why you've chosen that. So I would say this is a handout I made for a 6-year-old child and their family who speak Urdu. Visuals and pictures with words in both English and Urdu. So this will give the peer assessor an indication of why I've chosen this, especially if you have something that might be something that needs some information. So this is how you've uploaded. There we go. First piece is uploaded. Now, let's say you find something you think, oh, this would be even better for the SAT as evidence. So you can remove and add something new. So again, as Sarah said, one piece of evidence. We don't want to give our peer assessors too much to look at, because it's a lot of extra work for you. It's a lot of extra work for them. So if I find a better example for 4.2, then I can go on. There's a little red stop sign here, and if you click on it, it'll ask if you want to delete the file. So if you see OK, then it's gone. And of course, I would probably want to take out the comment as well. OK, I think that now is actually a great time that we can stop for questions.
Okay, so there is a question, and I think they just want some clarification. And this is a common question, actually. They want clarification about where are they uploading this evidence. Are they putting it in their 2023 or their 2022? We are wanting your evidence in 2023. So we're looking at this year for you to upload all your evidence. I think sometimes the confusion comes up because of where you put your CLACs for last year, for 2022. But the peer assessor will be looking at this year's practice description, 2023 practice description, this year's professional standards and all the evidence you upload, and this year's learning goals, 2023. But they will also be looking at your 2022 CLACs. So if there's any additional evidence you want to put in regarding the CLACs, you can also do that. All right.
It's true. But the only SAT that the peer assessor will have access to is 2023. So if you've uploaded things by accident to last year's, then you're going to have to move them over.
Okay. Although they can look at 2022 learning goals and CLACs as well,
Yeah,
because
right.
of the drop down at the top. Yes, they can. Yeah. And there is a question about 1.1. Isn't the criteria for beginning and ending intervention your education and college membership? No, not really. So it's maybe, Dana, could you pull that 1.1 up again? I think let's just have a look at that one together.
Absolutely.
It's about what your own organization or your own clinic has in terms of what criteria. So it's referral and discharge criteria. I know where I used to work in the hospital, we had very specific admission discharge criteria for outpatients and inpatients. People do in rehab units. I think certainly in home care, community places. So what you'd be looking for in your patient record may be a reason why they were discharged, and how it meets your discharge criteria would be one example. I'm trying to think, maybe there's very strict admission criteria, in which case, I guess if it didn't fit the admission criteria, they wouldn't be seen at your place. But more the discharge probably, like what are your criteria, and when you maybe provide something regarding discharge, why you've discharged a certain patient. Maybe they've met all their goals. That could be discharge criteria.
Yep, absolutely. Okay, I see some more questions here. Can a piece of evidence be used for several indicators? Absolutely. If you look at Sam the lizard, it's the cat, I can't remember. If you look at the page that we had before, there are actually a few things on there. One was about documenting that they canceled an appointment. Maybe you'd use that for 1.2 documentation. There was something about collaborating with others. Maybe there's something on there about being respectful of their diverse background. So you can, but remember, you're trying to show who you are as an audiologist or as a speech pathologist. So if you use one piece of paper that shows consent, that shows documentation, that shows everything, then you're not giving your peer assessor a really great idea of who you are. That said, you can use the same thing, and if you do, just highlight it so that your peer assessor knows what it is they're looking at, especially if it's a longer note. There's other questions about how do you show evidence for this? How do you show evidence for that? Let's say you have a conversation with someone. If that is reflected in your record, then that is something that you can upload. So these are things that you're doing anyways as a speech pathologist or as an audiologist, and so that's what you're trying to upload the evidence for. And of course, you can use the comments.
Mm-hmm. And another question is, does it not say the documentation must come from the last 3 years? And what we're saying is ideally evidence needs to sort of be as current as possible, but we know people have maybe been on some type of leave and they may not have been there for the last year and a half or so, in which case you may want to select something that goes back as far as 3 years ago. Ideally, the more current, the better. Would be good.
Yep, absolutely. All right, I'm just looking through some of these questions. So again, just to clarify on when something is needed from patient records and when it's not, an example would be, say, under consent. We say that, there's lots of examples of things that you can do for consent, but we actually specify that this is a time that we want the evidence to be from a patient record. Having a blank form that says, this is consent that we get in my workplace is very different from having one that has the information filled out. And you can talk to the peer assessor about what it is that you say to get the consent. But remembering that consent is not just a piece of paper, it's a conversation. So whether it's a note in your record to say that consent was obtained and the conversation was held, or the consent form, that's what we're looking for when we say patient record. So I feel like there's a bunch of questions that are coming in about how do we know if it needs to be from the patient record, or can you clarify this or that? Again, you're going to use your best judgment to decide what represents what you think the peer assessor will want to know. And most importantly, the peer assessor will let you know if there's something that they have questions on or there's something that's not clear. And you have the benefit of meeting with them to have the conversation as well. Okay, I think we're going to stop with questions for now so that we can keep going, but we will take more questions after, we promise, and if we didn't get to yours, we will get to it then. So another thing that will happen is for the peer assessment interview is that you'll be discussing 2 documents. So this is under 5.1. Again, everyone's familiar with this, having just completed their SAT. So every year there is 1 required reading, and that is something you'll be talking about. So sorry to flip through so quickly. This year it's the Guide for Equitable and Inclusive Services. This is something you had to read to complete your SAT, so you'll be discussing it with the peer assessor. You then get to select another document to discuss. Let your peer assessor know ahead of time when you email each other what that document will be. And then just as a small tip for the SAT, you do not need to read all the documents every year, but you do need to be aware of all of them. And let's say you have questions about supervising support personnel, and so you read you read the position statement in November. That's something that you can check off. Another thing you'll be talking about are your learning goals and CLACs. So you want to upload evidence for 2022 for your CLACs and write in any CLACs you have. If you have any CLACs for this year and 2023, absolutely put them in, not a problem. So we can even go over that because there's another thing that sometimes people miss. So let's say someone has attended the advertising e-forum that was held in January from CASLPO, so we go along with this goal. So I think everybody knows already to have the what to do in here. Attended CASLPO advertising standards e-forum, and so enter the date. That was January 26th. It was 1 hour, and it was group learning. There we go. The other thing that you need to do is you need to fill in how far along you are in the progress towards meeting your goal. And you also want to put in the impact on your practice. And there are no right or wrong answers for this. It's really about your learning. Your learning might be something new or validating what you already have learned. So maybe you're going to say it'll be moderate, but that's something that you need to do.
And save changes.
Save, yes, let's save that right now, just because it's a good thing to do. Okay, Sarah, back to you.
Okay. Let's now take a look at, okay, so this is everything you've done, uploading evidence and putting in your learning goals, putting in any CLACs. That's all excellent. I think one other thing I forgot to mention about evidence review, evidence uploading it, is we really want to see information from patient records, not blank forms. You know, a blank consent form or a blank screening or a blank case history form is not going to help the peer assessor understand how you use those forms. So what they want to see is evidence that, yes, you've used a consent form with a patient, you've used a case history form with a patient. So they want to see the completed forms. That will be much better. So once you've done all your uploading of evidence by March the 7th, what we're doing in the background here at CASLPO is training the peer assessors. We train them every year. We have some new peer assessors, so they go through some additional initial peer assessment training. And we match them according to your professions, your area of practice, and the age groups you work with, and which language you prefer. So I believe, Dana, they've all already sent you emails. List, you know, I'm a clinical, I'm a non-clinical, I prefer French, I work with this language, or which area of practice. So then you will receive an email from CASLPO, which will let you know which peer assessor will be doing your peer assessment. You have the opportunity to veto this one time. And if that is something that you want to do, then you will be provided with a second name, and then that will be the peer assessor that will be working with you. They will reach out to you. You've given them your email or your phone number or both, and they're going to reach out to you. And they're going to, even before they reach out to you, they are going to take a look at the evidence that you have uploaded, just to check that everything's looking in order. and they're going to then contact you so that you can decide on a date that works for the virtual interview. So as soon as you've mutually agreed on a date and which virtual platform works for both of you, and this is sort of a mutual decision. I know some of you, depending on where you work, have certain virtual platforms that you always use, and you might be most comfortable with those. So it's an agreement between you and the peer assessor. And in terms of how long the interview is, it's about 3 to 4 hours on average. You want to give it half a day. For some people, it can be a bit quicker, 2.5 hours. If you're non-clinical, it tends to be a bit shorter, only because it doesn't include some components, such as the clinical reasoning tool. So ideally, you're going to choose a date, a platform, and the peer assessor is going to let us know, confirm with us the date, because it helps us our end. If we know that, I don't know, 20 of you are getting peer assessments in April and May, then we're going to plan the Quality Assurance Committee meeting at the end of May so that that helps the process go much quicker. So you are going to, when it comes to the interview, what is this involving? So components of the interview really start out with you and the peer assessor having a conversation about your practice. They will have read what you wrote in the practice description. They would have looked at all of your evidence and the comments that you added in. And it's this opportunity to have a chat about how you practice, the kinds of patients you work with, and what's been going on. In addition to this, they will be asking you some behavior-based questions on standards that have been identified as higher risk of harm. Now, the appendix that Dana showed you earlier tells you which of those indicators will have behavior-based questions attached to them. For the clinical people, there are about 6 to 8, especially audiologists, because one is 1.3. And those of you that work with support personnel, there's also a behavior question on that. If you've completed the non-clinical peer assessment, then there are 4 behavior questions. And again, there is an appendix in your guide that tells you which ones apply to you. The peer assessor will have looked at your learning goals for 2023, and they will have also reviewed your 2022 learning goals and the CLACs that you collected in 2022. Again, there might be an opportunity, just as Dana showed you, sometimes people forget to mark off the impact or the progress. You know, was it minimal, moderate, high? So there may be some pointers. And in terms of the types of goals you've chosen, have they been specific enough? Are they time limited for this year? Are they realistic goals? So that could be part of the conversation with the peer assessor. For those who have completed the clinical self-assessment tool, guess what area I used to work in? So for those who are clinical, doing the clinical ones, what you have to do is choose 2 patients from your practice that you want to talk about for this clinical reasoning tool. So ideally what we're looking for is 2 different types of clinical presentation. So as I just declared, I used to work with swallowing, but I also worked with outpatients with aphasia, dysarthria, fluency, voice. And so I would pick 2 contrasting ones, maybe a voice and maybe a swallowing. Somebody else, Dana, worked with children, so she might choose maybe something related to language and something related to speech. As an audiologist, you might choose something like a hearing aid prescription, clinical presentation, and something as a contrast, maybe cerumen management. So really 2 types of patients. And then also, we have discussed this already, the Guide for Equitable and Inclusive Services will be one of the required documents, and the second one will be one that you choose that is relevant to your practice. Okay, so Let's
So
just,
actually, we'll stop for another
yeah.
question break. And to mention also, the clinical reasoning tool will be part of the interview that will be audio recorded. This will allow the peer assessor to write the notes and then review them again later. Okay, so we have a question that just came up. I see patients and they only have one problem. What should I do? So there are some people who only do swallowing or only do motor speech, for instance. So patients are different, and if you don't have, say, motor speech on autism, maybe there's other presentations within your group of patients. So it might be, if you're doing swallowing, it will be someone that had a stroke and someone that has ALS. Those are very different presentations, or a pediatric patient. If you only see people that have motor speech, then you can choose someone where language was affected, or there's another presentation, there's something else like autism, or family dynamics are involved as well. In the past, you would have had 5 records. You would choose one and the peer assessor would choose another, but if you want to have 2 records instead, that's okay. We also have the question come up all the time, can one of them be the same record that was used for uploading evidence? Absolutely.
Okay, another question. I use an electronic file system. Will the assessor need independent access to the file system, or can I pull up files and guide them through from my end? So, I mean, first of all, if the evidence you've provided and uploaded is sufficient, there would be no need for the assessor to look any further. If you are using a secure platform and you feel the need to maybe explain further, and you're also comfortable about sharing some specific information, as Dana said, this is already a very secure, the SAT is a secure platform that is being used. So I think it depends. Hopefully the evidence that you've provided is sufficient along with the comments. That would be the best.
Other questions and comments. You're only uploading evidence for things that you have said you either meet the standard or need work to meet the standard. If you said something's not applicable, then you don't need to upload evidence because you probably won't have any. Financial records, 1.10 is a common one for that. Or if you don't supervise support personnel, then it should be saying not applicable and you do not need to upload any evidence.
And I'm just going to come back to that one that I was talking about earlier as well. What if the peer assessor is not satisfied with the evidence you've uploaded? They will let you know. They will let you know ahead of the interview. So they're going to review all your evidence. And let's say they feel like, oh, there isn't sufficient evidence for 3.1 consent for services. They will get back in touch with you by email and they'll say, please, can you upload some more evidence on 3.1 that I obtain and document consent for services. So that's another thing that will happen.
All right, I see some questions that I'm very excited about. You'll see why. If in the record we enter notes, I'm going to enter notes into the record on about an intervention, and then notice that some things have been missed and add the others a little bit later. Is it okay to have both dates? This is what being a clinician is about. This is what happens. I'm sure that everyone has at some point in their life had to make a late entry. And so if your records show that, that's perfect. So you might have the original date and then something later saying late entry, I don't know, additional notes to whatever the first date is. Absolutely. Again, this is about using your professional judgment. And if you have something where it's like a little bit of an oopsie, I'm going to say a little bit because it's not even, I wouldn't even count this as an oopsie. That's a great way to show this is what I do. I've made a mistake by forgetting to write something down, so I've added it afterwards.
Okay, yes, we've got other questions and I'm just looking at them.
So there's a bunch of questions here on things that we've touched on. And so I'm going to say, go back to the guide. Have a look through the guides. I mean, you should really only look at the clinical or the non-clinical because a lot of it is duplicated. You don't need to spend your time on both of them. But have a look through the guides. And then if you still have questions after this, you are welcome to send us an email or give us a call. Sarah and I and Julie are very happy to answer questions. But I feel like some of these will be available in the resources that we have online.
Okay, another question is, can you please discuss the patient chart checklists? Do we need to upload anything for that? Does the entire medical record need to be printed out, or just the components that show what is required on the checklist? So these patient chart checklists are for you as a checklist. So I know, you know, there's the chance to go through 10 different records and check off, yes, I have the name and address of everyone, I've obtained consent, yes, I've done this. So really, they're your own checklists. So you don't really need to upload that. But what you might find is there a pattern that you keep missing one thing? Maybe you keep missing reliably documenting consent, and that checklist will help you see that. So you don't really need to upload that, but it's a way, it's kind of another way, a checklist for you to figure out, have I got missing pieces in my record keeping? And then, does the entire electronic medical record need to be printed out? No, not necessarily. We're not looking for entire records. Having said that, I mean, I know sometimes I would see an outpatient and it literally was 2 pages. I did initial assessment and there was maybe some small intervention required and I was done within, you know, 2 sessions. So that would be an entire record. But other records could be pages and pages. So absolutely not. We don't need lots of pages, just the evidence that meets that part of that professional standard.
Yeah. And also, because the interviews are now virtual, the peer assessor will not have access to your entire file. I think in the past you could actually hand them something, or I mean, you can even share your screen during the interview, but because it's virtual, there's less reliant on having the whole file or looking back 10 years, I think was one of the questions. And we're really looking for more current things. All right, so let's go back. We'll finish talking about what happens at the end of the peer assessment potentially and what happens afterwards, and we'll have more time for questions at the end. Okay, Sarah, back to you.
Okay, so another part that happens. All right, so the interview has been completed and it becomes, well, you're in the interview and it becomes apparent that there are 1 or 2 professional standard indicators that you do need some work on. You might identify it, the peer assessor might identify it, you might both identify it at the same time. It becomes fairly evident, in which case there is something called virtual remediation. And so what happens here is that you and the peer assessor agree on a solution. Is it something you can fix in a short time frame and that you can provide new evidence to show that you now meet that indicator? So you'd need a short time frame, we'd say like a week to 4 weeks. Some people can do it within a day or 2. You would upload that new evidence and you would identify a learning goal and provide some continuing learning activity credits to show that new learning has taken place. So why do we do virtual remediation? So I know that we reached out to some other regulatory health colleges and it became very clear that in the moment education and remediation is one of the most effective catalysts for change in knowledge, behavior, and activities. And the idea of the peer assessment process is that it is collaborative and educational. It is a peer who is coming to chat with you about your practice. So the idea is cooperative and that you're accountable. So if the indicator is one that is a minor patient risk versus a significant patient risk, then this is something that you would do, some virtual remediation. And we can give you some idea of some of the indicators from last year, which were areas that needed work for some registrants. I think we had 8 people who did need some remediation. So these are giving you some idea of which ones they were. So indicator 1.2, I maintain records in a reasonable time. So it could be that the records were missing what needs to be put in there according to the records regulation. They weren't organized, or they were missing data. Indicator 1.5, sometimes the problem here was that people, yes, they provided one piece of evidence, but this one needs two pieces. The indicator 1.10, I maintain financial records which accurately reflect the services provided. And so people would provide their invoices that they sent to patients when they're in private practice, but maybe one piece was missing. They had put down the patient's name, the treatment offered, the date, etc., but they left out their own name, who provided the service. So that might be a missing piece of information. A couple of other indicators that required remediation included the consent ones. So 3.1, 3.2. People are on the whole very good about obtaining consent, but not always reliably documenting consent for all intervention plans or courses of action and any significant changes thereafter. And another type of consent that you need to obtain and document is how you collect, use, retain, and disclose personal health information as required. And I skipped one there, 2.6, is developing and maintaining a professional network for seeking feedback. And this is important. It doesn't matter how many years of experience you've had, that we all maintain and keep that professional network going. I know it didn't matter any year. I was always encountering new types of clinical presentations, new types of diagnosis that I'd never encountered before. And I needed to reach out to others, could be to colleagues, could be to leaders in the field. I needed to connect with others, maybe about an intervention approach that is new. And patients come to me, they're all reading up things on the internet, and they say, oh, well, what about this type of approach or this type of new intervention? And you may be caught unawares, and you may need to reach out to other people in your profession or beyond for additional feedback. So those are some ideas of which indicators have been remediated last year.
Absolutely. Okay, so now you have finished the peer assessment, the day is done, you've said goodbye to your peer assessor. At the end of the peer assessment, your peer assessor cannot tell you if you were successful. That is determined by the Quality Assurance Committee, but you should have a good sense of how things went based on the conversation and if there was any remediation. So let's see what happens next. The peer assessor will write up a document within 10 working days. It will be a summary or a report. A summary is short, and it means that you have met or exceeded all expectations. The summary doesn't really reflect all of your work. It's very brief. If there was any remediation for one or two standards, once it's completed to the peer assessor's satisfaction, a summary will be written. A report, on the other hand, shows which indicators still need work. So this might be because there were many indicators not met, or the indicator requires more than just online remediation, or the remediation was unsuccessful. And then the Quality Assurance Committee will direct you on how to proceed. You'll get sent a copy of the summary or report and have a week to provide a response to the committee. The report, the summary, and any information that you send are all anonymized. So the Quality Assurance Committee won't know your name. They'll just know that it was peer assessment number 162 from 2023. The Quality Assurance Committee will decide if they need more evidence or if you have the required knowledge, skill, and judgment. The committee meets about every 6 to 8 weeks, starting in the spring. You'll get an email afterwards letting you know the final decision of the committee, hopefully congratulating you for completing the process. You'll also get a survey from the Quality Assurance team, and you may feel like you're doing these surveys all the time, including today, but the feedback has been really invaluable and informs future peer assessments. So I think the clinical reasoning tool actually came out of survey feedback that we had from people that had finished their peer assessments. So we have included here, we have one handout that is just tips from peer assessors of things that they find they like to see. Better for you to have that information before rather than after. And then we also have some feedback survey from last year.
Yep, so some of the feedback, really, I think the message is coming through is the peer assessors also want to try and make you feel as comfortable as possible and trying to reduce the stress level that you might be anticipating. There's nice feedback about they enjoyed the discussion and even sharing peer-to-peer. I mean, I know as a peer assessor, I actually love seeing some of the evidence that people would provide, and they had done some amazing maybe educational presentations and created some handouts that were of interest, mutual interest. So really, I think what they're aiming for is to try and make you feel as at ease as possible. And the emails that you exchange pre-interview, I mean, there's lots of opportunity for you to ask them questions as well. You can do that. And really overall, people were appreciating that somebody put you at ease. And sometimes it felt like a long discussion with a colleague, and especially the clinical reasoning tool part. I mean, this is an opportunity where you can talk about your patients and you can share with them what happened, you know, and why you did what you did. So I think we've still got some time for some questions as well.
Right, so let me stop sharing.
Somebody said, are we to upload the completed clinical reasoning tool itself for the 2 cases, or is this just to guide the discussion? Yes, so you don't need to upload the clinical reasoning tool. If you want to practice with it, as Dana said, it's available in this peer assessment as part of the resources on the website. You can take it, you can talk through one yourself as a practice. You could pick a colleague and go through the clinical reasoning tool with them. So you don't need to upload it itself when you're discussing the cases. That's not a problem. And there was another clinical reasoning one. Okay, can the clinical reasoning tool client be someone from 2023 or who has interventions that straddles many years, including 2023? Yep, either of those is an option. You know, you're looking for someone that you want to talk about, that's maybe of special interest for some unusual reason, someone unique, an unusual case clinical presentation.
It could be a case that went really, really well, or it could be a case that didn't go well, and you can think about things you would have done differently, given the opportunity. And again, the clinical reasoning tool and the guide for it are available on the website. I think that there are some organizations that have actually taken the clinical reasoning tool and they use it in their annual reviews with their speech pathologists or audiologists because they find it's a really effective tool.
What if your professional network is all done by phone? How do you prove that? Okay, that's a good question. I mean, typically when I've seen uploaded evidence in that section, maybe somebody's part of a special interest online group, emails reaching out to other people. Maybe you've got notes from your professional conversation on phone. So it's, I think outside the box. Try and think of other ways that you can provide that evidence.
Some clarification on the number of files. So again, your evidence for uploading needs to be from at least 5 files. If you want to do more, great, you can do more. But we need to see PR 1 through 5, or the peer assessor needs to see at least PR 1 through 5, and then more would be up to you.
Oh, question is, can you email that list of components of the interview to us? It is all in the guide. It is in the guide. This recording will be posted on the website as well. But really, I think we can't emphasize enough. We have put lots of information in the guide. Oh, I know what's nice in the guide is there's like by the month. Near the end of the guide, Dana, I think it goes like what you do in January, February, March, April, May, and there might be a quick summary in that page as well.
Yes, I think there is. And just to remind everybody, this is just a screenshot, but you can go on to, I don't know how many people are currently on the peer assessment website to see what we have, but we do have the guides for clinical and non-clinical peer assessments. We have information on the clinical reasoning tool and the actual tool itself, as well as information for employers. And if you are interested in the evidence review guide, you can see that as well. but we can look at it, and I think that is a great point that you can see the timeline. The guides can be quite long because there's lots of information, but you can really focus in on the information you have, look through it, and then get back to us with more questions if you need to.
Okay, somebody is commenting they have looked at the month by month in the guide, so that's nice. Okay, thanks. All right. You know, and we're very aware, obviously, you've all got your individual questions. If we haven't answered them in this webinar, there's always restricted amount of time. We may not have addressed everything. The resources are there posted that Dana's showing us right now, but you can reach out to us as well. The other option is registrants who've been peer assessed in the past have let us know if they are willing to talk to you. If you'd like to talk to one of them, we can connect you as well. So that's another option.
Absolutely. So I guess just in closing, we wanted to say, use your best professional judgment for what to upload or what makes sense. If you have uploaded something and you've written a comment and the peer assessor has more questions, they'll let you know, but you'll also have the opportunity to talk with them. This is about you as an audiologist or speech language pathologist, and think about what best represents you. So we have on here our emails. Here's my email and Sarah's email, as well as the quality assurance email, and you can find these on the website as well. We're both practice advisors, so you can link to us there. But I would suggest looking through the resources before you give us a call, just because the answers might be there, and it might be quicker than waiting for us to get back to you. So hopefully this was really helpful. Thank you again for watching. Wishing everybody best of luck on their peer assessments. You will get through this and it will be great. Perhaps you'll even join the rank of peer assessors in the future. All right, thanks everybody.
Thank you so much. Have a great rest of your day. Bye-bye.